Madam Director General, Excellencies, Ministers and Heads of Delegation, Regional Directors, Vice Presidents of the Assembly, distinguished delegates, ladies and gentlemen. First, let me thank the Member States for electing me as President of the 70th World Health Assembly. Allow me as well to give particular thanks to the Member States of the European region and its Regional Director, Zhuzhana Yakov, for proposing me as candidate to this high position. We consider that this decision is a sign of recognition of Russia's achievements: health system development, universal health coverage, effective public health measures. Thanks to these efforts, Russia's life expectancy has increased 6.5 years in only the past decade, and we have reduced to a historic minimum mother and childhood mortality. And we have reduced the burden of communicable and non-communicable diseases. Russia is presiding over the WHO for the first time, indeed at a historic juncture, a juncture at which we will determine the future and the direction of the development of our organization. This means that we all have a special responsibility, and I will do everything in my power to ensure that this meeting will be as organized and as fruitful as possible. Distinguished colleagues, our joint work at the global level is aimed at achieving a very important goal, namely ensuring health for individuals for the entire life cycle, as it was laid out in the SDGs, the Sustainable Development Goals, adopted at the highest political level in 2015. To achieve this objective, we must establish a common environment, an environment conducive to health, which brings together mechanisms at the national, regional, global, and intersectoral levels: governments, members of civil society, professional medical unions and patient groups, and the private sector. Reducing risk factors, forging a spiritual, moral, and physical foundation for good health, developing preventive measures in the largest possible sense of this word, these are the watchwords for preserving health to the highest degree, and this from the earliest moment of childhood, even pregnancy, and throughout the entire life cycle. We live in an era of accelerated innovation in biomedicine, an era of discoveries, individual genetic programs, and their interaction with the microbiosphere and other environmental factors. These discoveries should help us determine individual health risks and allow us to take them on board in developing health programs for each individual. We should keep in mind that a great deal has been done to achieve some of these ambitious goals. Allow me to express thanks and recognition to the Honorable Director General of the WHO, Dr. Margaret Chan. Margaret, thank you very much. Margaret has worked relentlessly for more than a decade and has been at the cutting edge, an initiator and an inspiration of public health. As such, we have an organization that is able to reduce global mortality through measures adopted by the WHO and its member states in the field of communicable and non-communicable diseases. We are proud that Russia hosted in 2011 the first global ministerial conference on healthy lifestyles and NCDs. At that conference, we adopted the Moscow Declaration, and this was the starting point of a global process, the mobilization and unification of efforts to combat NCDs by resisting unhealthy lifestyles and bad habits, irresponsible behavior of individuals with regard to their own health and that of their families. The Moscow Declaration was a political declaration. It was adopted at a special session of the United Nations. Today, more and more countries are implementing the common principles and strategies of this policy through global mechanisms established by the UN Interdepartmental Task Force on combating and preventing NCDs. Over the past few years, the world has been confronted with dangerous disease outbreaks, influenza, Ebola fever, Zika, and forgotten tropical diseases. Under the flag of the WHO, we have developed new vaccines and new therapeutic drugs and provided large-scale assistance to impacted countries. At the same time, this work has shown us all that there is a need for further development and global preparedness against large-scale outbreaks. The lessons learned from epidemics had led to the reform of the emergency response cluster of the organization and the establishment of a special program, the objective is which is to strengthen country capacity in ensuring individual and collective health safety. There is no doubt that conditions must be met for the unswerving compliance to the international health regulations, the IHRs, on the basis of commitments taken voluntarily by member states. We've seen in the past few years a tremendous increase of antimicrobial resistance, AMS, which is now a leading threat to the contemporary world. In this area, we've also done many things. The Ministerial Conference in The Hague in 2014 set out a comprehensive and intersectoral approach to attending to AMR. We adopted the global strategy and the plan of action on combating AMR resistance to drugs. This political weight was strengthened by a declaration, a high-level declaration at the UN General Assembly. Our common goal is to effectively develop a global mechanism which will be implementable at the national and regional levels. Visible progress has been made against tuberculosis. Overall, the MDG on TB to stop it and to set a positive trend by 2015 has been achieved. Now, we have an even more ambitious goal within the framework of the MDGs. Put an end to TB by 2030. The Russian Federation is still one of the countries with the heaviest TB burden. However, over the past 8 years, we have, thanks to comprehensive and effective measures, we have seen a reduction in TB morbidity by more than 35% and mortality by 65%. We see improvement in this trend every month. Given the importance of this issue for the MDGs, the Sustainable Development Goals, Russia will host in 2017 the first global ministerial conference of the WHO on tuberculosis in the context of the SDGs. Distinguished colleagues, we would like to invite each and every one of you to take part in this meeting, the first ministerial conference dedicated to tuberculosis, on the 16th and 17th of November in Moscow this year. I would like to highlight once again that all of these achievements in the field of public health would not have been possible without the professionalism, the tireless efforts and commitment of Dr. Margaret Chan and the professionalism of her staff. Under your leadership, Madam, we launched the global reform of the organization. We increased several times over the budget of the organization. A great many positive changes have taken place in the organization that one cannot ignore. I would like to sincerely thank you, Madam, for your selfless efforts over the past 10 years. at this very important post. I am certain that you will hear many words of thanks during this meeting. Distinguished delegates, as you know, at this session we will elect a new DG. For my part, I would like to reassure you that I will do everything in my power to ensure a transparent and fair election in strict compliance with the relevant procedures. As I wrap up my speech, I would like to say that many of the issues that I have touched upon are part of the agenda of this meeting. Indeed, this is one of the richest in the history of the organization, and this means that we have to be especially effective and economical in our efforts. I promise to bring to bear all of my experience to ensure that the discussions here will lead to the best decisions possible. I have a clinical specialty, and that is to help individuals who suffer with strokes. And in this specialty, I have only a few minutes to act. This is the therapeutic window. During the meeting, we will have just a few minutes sometimes to express one's position, to lay out one's ideas. And I am certain that the reduction or time limits will not prevent us from doing so or dealing with the most important issues. I would like to thank once again to all of the staff members of the WHO, which will be working behind the scenes over the coming days to ensure that we have a successful meeting, and to thank the interpreters who help us understand one another. May I wish you, delegates, a very successful and constructive meeting, and also, if possible, after the meeting, a short break during which you will be able to focus on yourselves, on your own health and well-being. Thank you.